In Australia, there are 22,000 hip fractures every year. That's 3.6 hip fractures every minute, or 425 hip fractures every week. The cost to the Australian economy approximates to $1 billion, with that cost set to rise. The human cost is enormous. Anywhere between 7 and 8% of people who sustain a hip fracture will be dead at 30 days. Up to 25% will be dead at a year. Almost 50% will never recover their previous level of function.
And we know that the care can be improved. There's very good evidence now on what should be done to care for patients with hip fractures. So what we did is in 3 arms. We started by developing evidence-based guidelines for the care of hip fracture patients, and these were produced in 2014. We went on from there with the Commission on Safety and Quality in Healthcare to produce care standards and quality indicators in order to be able to benchmark and tell us what is good care and how is it being achieved. And now we have the Australian and New Zealand Hip Fracture Registry, which is recording those exact quality indicators for hospitals in both countries. And we can use this information in order to feed back to the hospitals and tell them where their care can be improved and to tell them when they are doing a good job.
We're enormously grateful to our people who nominated us for this award, Professor Peter Schofield from Neuroscience Research Australia and Professor Deb McConey from the Australian Commission on Safety and Quality in Healthcare. Irrespective of the outcome, we will continue to strive to improve outcomes for hip fracture patients in Australia and New Zealand.
Thank you very much.